I'm about to start my shift. It's just before 7 o'clock in the morning right now. Last night before I went to bed, we had over 60 patients waiting for a hospital bed.
This is our ED. You can see all the rooms are filled. Usually these halls are very neat and empty. And now you can see there's patients everywhere because of this. It makes it very hard to work, and we're trying our best to treat everyone that we can.
At the epicenter of America's COVID-19 crisis.
It's very hard to lose a patient that you've been fighting for.
The coronavirus has passed a grim milestone.
Number of deaths, all-time increase up to 35, 65.
Even as cases in New York continue to jump too, Governor Andrew Cuomo says the state might be about a week away from hitting its peak.
It's good that we're not at the apex because we're not yet ready for the apex either. We're not yet ready for the high point. We're still working on the capacity of the system. The more time we have to improve the capacity of the system, the better.
The destructive spread of the coronavirus through New York has left many healthcare professionals overwhelmed.
Go home and have a quick shower. Hopefully scrub the coronavirus off my body, if not off my soul.
I'm tired. I'm going to go home, and I'm going to try to sleep, and then we'll be back tomorrow. I want to say that, the things that I see in the ER are scary.
In nearby New Jersey, where officials reported hundreds of new coronavirus deaths on Saturday, COVID-19 has now killed more residents than the September 11th terrorist attacks. The state's governor tweeted, "Let that sink in for just a moment. This pandemic is writing one of the greatest tragedies in our state's history." Elsewhere in the United States, Americans spent their first full day under a new federal recommendation that they should wear some sort of face covering during the COVID-19 pandemic. Although President Donald Trump isn't taking that advice for himself.
You can do it. You don't have to do it. I'm choosing not to do it.
Here's how you can make your own face covering in a few easy steps.
The Centers for Disease Control and Prevention wrote in its recommendation, wearing a simple cloth face covering in public, like grocery stores and pharmacies, will help people who may have the virus and do not know it from transmitting it to others. But the CDC added it is critical to emphasize that maintaining 6 feet social distancing remains important to slowing the spread of the virus. For City News, I'm Caryn Ceolin.